Assalamualaikum. I'm Dr. Tengku Putri Zainab, resident consultant pediatrician from Sunway Specialist Centre, Damansara. So the topic of the video today would be on Covid-19 in children, which is a very hot topic now. And Covid-19 is indeed a global pandemic. It has infected more than 1 million people worldwide. And COVID-19 being a new virus, a novel virus, there are still a lot of uncertainties, especially how it affects children. So today I want to share on some of the frequently asked questions or FAQs on how coronavirus or COVID-19 affects children, sourced from CDC, WHO as well as UNICEF. So we do know now is that COVID-19 can infect everybody, regardless of their age, their gender, their ethnicity and their social background. But based on the available evidence, we do know now that adults make up most of the cases to date. There is this large study being done in China where the outbreak began, and that involved more than 70,000 positive COVID-19 cases. And out of that, 2.4% of them were actually children less than 19 years old. And even a smaller number, which was about 2.5% of them, had severe symptoms. But still, there's still a lot of research will be needed regarding this. Well, the symptoms are actually indeed the same compared to adults, but it is said that the symptoms in children are actually milder. The mechanism is still unknown. There are some postulations. Maybe it's because the immune system of a child is immature compared to adults. Some say it could be some social factors, like the kids are not really exposed to the virus because they're always confined at home. Or maybe there's some biochemical factors, like the receptor that is involved in the binding of the virus, the receptor which is the protein on the cell, is not mature or even not present in a child's lung. And this will cause mild symptoms in children. So what are the symptoms? It is actually cold-like symptoms, for example, like fever, cough, runny nose. In fact, vomiting and diarrhea have also been reported. Again, there's also another study in China based on about 2,100 children with positive COVID-19 infection. And out of that, actually 90% of them either had no symptoms, mild symptoms or moderate symptoms, which means that we can see that this majority of children did not have any shortness of breath, did not require any oxygen and was not admitted to the ICU. In fact, what this study adds is that most of the infants, which is less than 1 year old, they are more prone to get severe infection. And out of this study, there was only one reported death, which was one 14-year-old boy, but not much of other information being given regarding this case. Another thing to highlight is that even though a child does not have any symptoms, it doesn't mean that the child is not infected with COVID-19 or is not able to infect the virus onto others. This is the reason why social distancing is important, even though in children, and also frequent hand washing is also important, so that the virus does not get transmitted to another older adult or an elderly who are more prone to get severe infection. There is also no available evidence to say whether a child with an underlying medical condition or a specific healthcare need, for example, if the child has got diabetes or asthma, whether this group of children are more susceptible to get the infection. But again, a lot of research still needs to be done regarding this. Well, you can actually encourage your child to do the same thing what everybody is doing, which is number one, definitely to stay at home, like what everybody is doing now. And also to encourage your child to practice frequent and also effective hand washing. And make sure that every time the child hand washes, it should be about 20 seconds. Yeah. And also to frequently disinfect frequently touched surfaces, for example, like tabletops, switches, remote controls, door handles, etc. And during this period, while everybody is staying at home, you should also practice healthy habits like healthy eating, and also make sure you are adequately hydrated. Practice indoor exercises with your kids, like doing jumping jacks or playing with jumping ropes, and even like taking a simple balloon and playing it like a tennis ball. You should also make sure that they have adequate sleep. Okay, so during this global pandemic, this COVID-19 pandemic, you need to balance between bringing your child to a well visit or for vaccination as opposed to the risk of exposing yourself and also your child to a person who is contagious with an infectious disease. So this is particularly important for newborns, infants, as well as young children to actually stick to their vaccination schedule, particularly their compulsory vaccinations, as opposed to an older child or maybe an adolescent that perhaps you could postpone the vaccinations to a slightly later date. In fact, our Director General of Health just recently announced in his press statement last week, reminding us that we need to stick to our child's vaccination schedule and also their antenatal health checkups. The reason behind this is also to avoid the vaccine preventable diseases in our children. Okay, what I would suggest is that you could actually give your pediatrician or your family doctor a call and discuss with your doctor regarding your child's immunization schedule and get very personalized, individualized advice regarding what is the urgency to get the particular vaccine for your child. Is it really necessary to bring my child out to the clinic? Well, we know that the general rule now is not to go out and stay at home and try to avoid your child from going to the healthcare system whenever possible. But the thing is, there are certain circumstances where you still need to bring your child out to bring to see a doctor. For example, if let's say your child has got high-grade fever for 3 days or more, or having vomiting and diarrhea, or having signs of dehydration like not passing urine for at least 8 to 12 hours, crying without tears and not active and appears unwell. Or let's say if your child has got bronchial asthma and appears to have difficulty in breathing. So these are the conditions where you need to bring your child to the clinic. Well, I know everybody is really worried right now, but again, what I can advise is you could actually call your doctor, speak to your pediatrician or your family doctor and see whether you could actually treat the mild symptoms or you urgently need to bring your child to the clinic. There are some precautions that you can take in which you could actually make an appointment to the clinic. This is to avoid long waiting time, and also while you're waiting at the waiting area, you can actually practice social distancing. In fact, there are clinics who actually separate the well children as well as the unwell children in their clinic, so that will minimize the risk of cross infections. That's all for now, and I hope you enjoyed and benefited from this video. Stay safe, take care, and I hope to see you again in my next video. Bye.